All right, well, new at 11, a product on the shelves of drugstores across America could help put a dent in the number of deaths by overdose. 41 NBC's Joy Dukes shows us what the timer cap is and how it works. Joy.
January, you may have seen the timer cap browsing in drugstores like a CVS or Rite Aid. Well, today I spoke with the man behind the brand, CEO Larry Twersky, who says his reasoning for backing the product goes back to his own childhood.
My mom was somebody who had opioid and prescription medication addiction.
Timer Cap CEO Larry Twersky says even though he couldn't turn back the hands of time to save his mother, time is still on his side. Or a timer, rather.
The timer cap is a patented stopwatch on top of medication caps that lets you manage your medications in the bottles they were dispensed in.
It helps patients by tracking the hours and minutes since they last took their medication.
You take it off, it cancels out that time. Then when you put it back on, it resets the timer.
You can find them at nearly any drugstore across the country for around $10, which doesn't compare much at all to what could happen if you don't follow the doctor's orders.
Medication non-adherence, it can account for 10 to 20% of hospital and nursing home admittances. So, you know, people taking their medication is very important, and taking it as their doctor prescribed is very important.
Neither of these prescription pill bottles can stop a person who's planning to take more than they're prescribed, but this one with a timer on it could make a difference in the number of accidental overdoses that happen in the U.S. every year.
More and more we do see accidental overdosing.
CVS pharmacy manager Tora Stewart says oftentimes an accidental overdose can happen by a patient forgetting that they already took their medication.
For example, the older population that may not necessarily remember when they took it last.
Or taking another dose too soon.
So they'll know if they've taken their medication, so it'll prevent them from taking it, you know, twice in a 10-hour period.
In situations like these, life and death comes down to the hours and minutes in between doses.
We see the timer caps being used for patient safety, to measure, monitor, and manage the medication, and for family and household safety to detect and deter unwanted openings.
These caps are ensuring that your last dosage doesn't become your last dosage ever.
3 Americans every minute call poison control because of dosage mishaps. 4 out of 10 of those mistakes involved painkillers, hormone therapy prescriptions, or heart medication. Nationwide, that's around 1.5 million medication mishaps every year.
Oh man, Joe, that's scary. Well, Twersky says the timer caps are especially good for folks who travel and you have kids. Those kind of people need them too, because then you'll know if anyone beside you have opened your medications.